Hello, and very nice to meet you, Noreen, though virtually.
Same here. Same here. Same here.
So I'm Soumya Swaminathan, and it's wonderful to be having a conversation with a woman who's had a similar, but I'm sure a very different journey with your own personal reflections about where you came from, what motivated you, and how you got here. And I think the idea behind this conversation is that through talking to each other and our own experiences, perhaps there'll be some things which jump out for other people. Particularly, I'm thinking about younger women healthcare professionals, something to learn and maybe be inspired by as well. So would you like to start off by saying about something about your family, where you came from, and what really motivated you to become an adolescent gynecologist?
Right. Sure. Firstly, it's a privilege and honor to meet you. Like you said, virtually though, but it has been an inspiration reading about what you have achieved in life, what you represent. So that's number one. And secondly, I would like to thank the society for actually taking this up, because we talk about medical stuff and researches so many times, but I think it's really also important to talk about our journeys, because in a few years' time, there'll be many fresh faces and new minds who would actually want to pursue a career in whatever they want to do. And I think it is very nice, and it's an honor to share our journey with them. So for me, I was the only child of my parents. My father was a textile engineer. My mother was an academic person. She was a principal. And my mother wanted me to really, really study well and hard. And my dad just wanted me to be happy. And the most important thing was that they never, ever, although we come from like a Zimidar family, village background and everything, but neither of them ever made me realize that they don't have a son. So for me, that was a very plus point versus all the girls that I saw around me. But then when I just wanted to become a doctor, I don't know why, and we don't know why. But anyway, when I came to the medical school, I was very charmed by the cardiac surgery department. So that is what I wanted to do.
Okay.
And when it was the interview, my mother always said, no, you should be a gynecologist. And the morning of the interview, we had the same discussion at the breakfast table. And my dad said, yeah, you be the first cardiac surgeon in Pakistan. And my mother said, well, that's fine if you want to do it. But there are many men who are very good cardiac surgeons, but there are hardly any women to listen to a woman's problem. And women have loads of problems starting from when they are young to till they're menopausal, and nobody listens to them. So I would rather my daughter listen to them. So finally, when I went to the interview, I opted for obs and gynae. And the first night on call, we had one woman with placenta previa, one woman with obstructed labor in the hand coming out, and we had one woman with ruptured uterus. And that was my first night on call in the biggest tertiary hospital. And myself and two other seniors, we went and operated. I assisted them, obviously, but we also gave them blood.
Mm-hmm.
Because, there's this whole 10-15 log gaon ke, but when you ask for blood, they all disappear.
So you had to give the blood?
Yes. All three of us gave them blood. And then that morning onwards, I never looked back. And I think I enjoy every single day of where I am now. I think enough about me. Let us hear something about you before we get into the professional journey.
So I grew up in an agricultural research campus. My father, an agricultural scientist, very well known. He was responsible for what is called the Green Revolution in India and Asia. My mother was a teacher like your mother.
Yes.
So some things were struck a chord with me, because we are three sisters, no brothers, but we were never ever made to feel that we are in any way different from any
Yeah.
boy in society. We were encouraged to do whatever we pleased, whatever hobbies we wanted. We were never asked about our marks in school or why we were doing well or not so well in studies. That was not considered the ultimate goal. And we were allowed complete freedom to choose our professions. Now, I wanted to be a researcher from a very young age, and I was especially fascinated with genetics. So I actually did not have medicine as a primary goal. But eventually what happened is when I was doing my pre-med, in those days you had to do a year of university before you could apply for medical school. All of my classmates were all going to write the medical entrance exam. And then my father said to me, you can still be a good researcher, you can still do genetics. Why don't you get a basic degree in medicine, because then you understand the human physiology much better, and perhaps that will make you an even better researcher. So it was just by chance that I actually even attempted and got into medical school. But I never lost my passion for research. And despite not really having much of an ecosystem that encourages research, like right through my undergraduate or postgraduate days, there wasn't a whole focus on research. It was mostly on clinical care in medicine, but I really enjoyed clinical care. I really never lost that passion for research. So I went and did a fellowship in pediatric pulmonology at the University of Southern California in Los Angeles, in fact, at the Children's Hospital. And there I had the most amazing mentors who taught me were as passionate about research as I was. And of course, it was a combined clinical and research fellowship. But I got the groundings in research methods, how to design a study, how to go about it, the ethics process, how to actually present it make a oral presentation in a conference, and how to eventually write that paper and get it accepted in a good journal. All of that I learned in those 2 or 3 years I spent abroad before I came back to India. And again, faced a challenge because I could not find a job, which I thought wouldn't be so difficult to do clinical work, research, and some teaching. But I was told that it's impossible. You've got to choose between the three, and you just can't do everything, which I had seen people in the US and the UK were able to combine all of these into one professional career. And so I ended up choosing a research-focused career, but I've never, ever regretted it. But I guess there were some similarities in our journey and some differences. What were some of the challenges that you faced, early in your career? I mean, you talked about these 3 very serious cases which came to the outpatient department on your first day, or rather to the emergency department. And that's what gynecology and obstetrics is in our part of the world, right? Or at least it's improving, but we still have big gaps.
Yeah, absolutely. You're 100% correct. We have come a long way, but still we have a longer way to go. In Pakistan, it is still almost 1 woman dying of the complications of pregnancy, childbirth, or within 6 weeks after almost 75 minutes or so. So when I was working in Lady Wellington Hospital, I just did my necessary requirement for the Royal College because I always wanted to go out study. So I went to London then, and I went for a 6 months unpaid attachment so that I could just do some polishing of my skills, take the exam, and come back. But you find people and mentors who care for you like their children and who nurture you like exactly you said. So I ended up being in England for almost 8 years, and my family had to join as well. And I worked and I got all the necessary skills. And there I learned the adolescent gynecology. Plus, I wanted to excel in cervical cancer screening because the first patient whom I lost on my watch, a young girl with cervical cancer, and India and Pakistan share the same problem with cervical cancer. We are one of those countries who have very high rates of not only new cases, but also mortality from cervical cancer. So after I came back, I had always decided that I was not going to work full time, but that I was going to do some research, like you said, do some clinical work, and then spend 1/3 of the day at home with the 3 children, mashallah,
Right.
that I had that time. But then so you're out of the mainstream in a way because you're not working in the government. But then it is amazing how the word of mouth carves a niche for you. So still have my private practice, but I started outreach work, and we founded a not-for-profit organization known as Girl and Women Health Initiative, so that I could go out, see the women who can't come to my clinic, and also raise awareness, like hygiene, diet of the girls, diet of the pregnant women. And then in all those camps, the women will bring their children. So we started having a pediatrician, and then they would want their husbands to be looked after as well. So we started a general physician. So it's been a very natural kind of evolution. And at this point, I chair the Pakistan Alliance for Cervical Cancer Elimination. I work as a WHI, and I represent the country as country ambassador in IPVS. So a lot of different things, and a lot of capacity building initiatives as well. So there's so much for women's health. Like you said, I think we can have 100 lifetimes and there's still work to do. Sorry, go on.
No, I was just going to say that while I was focused on infectious diseases, especially on tuberculosis and HIV, what I also observed was that the burden on the woman is not just the disease or the infection or, it is all of the additional social burdens that she has to take on. Even if it's her husband who is ill, like I worked with HIV AIDS patients in the early days of the epidemic when there was no antiretroviral treatment. Women were blamed, right, for the epidemic in our part of the world. It was the woman who was always blamed, even though it was a husband who was promiscuous.
But women are blamed for everything that goes wrong.
Exactly. So then they lose rights to the property or inheritance. Once the husband dies, they're thrown out of the home. They're back in their maternal home. They often don't have a job. They become dependent on the parents. And the tremendous psychological burden that they carry and the stigma they have to face in society. In TB also there is a big stigma, which is but both, obviously HIV AIDS was much more. So I realized that just being a doctor and giving them prescriptions was not enough, that you had to be much more than that. You had to become a friend, a counselor, a legal advisor, and sometimes you had to reach out to their extended families to sort out issues, get their children admitted in school. And we had a lot of HIV AIDS orphans that I was taking care of because I was a pediatrician. And unfortunately, at that time, not many people, even in the medical profession, wanted to work with HIV AIDS. There was so much fear that once you get the infection, it's like a death sentence. So, I found even among my own colleagues and peers that there were not that many people wanting to take care of these patients. So it was a very challenging time.
Yeah, doctors would actually shy away.
Right.
Oh yeah, pretty much similar story. So I actually wanted to ask you, but you took it up yourself, that as a pediatrician, you would have seen how a woman is almost like crushed under all those burdens, some of which can be seen and some of which cannot be seen. And me as an OBGYN, I think the biggest thing is that women approach you as maybe the one person they can talk to in confidence, have a judgmental attitude from, and they can trust.
Yeah.
And I think it is very important that we as their healthcare providers also are their confidants, and we have to be it has to be a very human-based interaction.
Did you ever face a burnout-like situation ever?
Oh, yes. Plenty of times. And many times during the training, but many times working independently as a consultant as well. Sometimes you end up with problems that you want to discuss with somebody like you did in the training. There's a hierarchy. And this is what I keep telling all my trainees in the capacity building initiatives that we are involved in today. In fact, also we were out of Lahore in outskirts doing a training, but I've just returned to the base conversation that, you should take every single day of your training very, very seriously, because you'll never ever have anybody to observe or to rectify the mistakes that we make. And it is very important to keep learning. I'm really impressed with your research thing, Soumya. I mean, I always wanted to do research, but I had to pay that price coming back to Pakistan. I just could not be involved in research, not working in the government. So that's a very fancy story I was reading about, from a pediatrician. Then, you went off to the global level, WHO, IRC, all these things. How would you advise, or what are your pearls of wisdom for girls and boys, of course, who want to pursue research? What would be your golden words for them?
Yeah, I think that's a really good question, especially for people in our part of the world. Because while things have improved in the last 30 years, research funding has gone up significantly in India. There are new institutions, opportunities have opened up. There are also some private institutions now that encourage research. There are philanthropists who've come in to top up government funding. So things are better. But still, it's a challenge. It's difficult if you've come back, after going abroad for a few years and you've done specialized training, or even if you've done your training in the country, you have a particular interest and a particular area you want to focus on, to find the right environment, the right mentor, the right team, to have the funding to do that, and to continue to pursue research, over a whole career. I think I was fortunate that I was in a government institution, as you said, so I knew where my salary was coming from. I didn't have to worry about that. Of course, one had to write grants to get research funding, but there was some amount of funding that was available from the government to do basic research on TB. But what motivated me and kept me going was, of course, the joy of learning something new and discovering something new knowledge, which could help better management of patients. That's a tremendous sense of satisfaction. But also it's patients who kept me going, and communities. I did a lot of outreach, a lot of community-based work, visiting the rural and the urban areas, basically where the very poor live, because that's the population that generally is more susceptible to TB. And hearing from them, what their day-to-day challenges were, that always kept me very humble and also kept me very motivated. But I also reached, there was a particular stage of my career early on when I was both feeling burnt out because of dealing with this immense burden of HIV/AIDS, that as a medical doctor, I had to see patients die before my eyes, day in and day out, because ultimately they reached a stage where no symptomatic or supportive treatment could keep them going, and we could not offer them antiretroviral therapy. And I think the whole world deserves a big gratitude to people like Dr. Yusuf Hamid and the other, generic pharmaceutical manufacturers in India, because if they hadn't stepped up and lowered the price of antiretroviral drugs, millions more people would have died. And today it's a disease which is completely controllable at a very affordable cost, and we've made so much improvement. Now, my journey to WHO was not a linear one or a straight one or even a planned one. I had absolutely no intentions at any stage. I did a stint there, just to have a change and to know more about global health. So from 2009 to 11, I served in the Tropical Diseases Research, which is a separate independent arm of the WHO that's focused on research on neglected diseases. I learned a lot because I was exposed to work going on in Africa and the really, really poor populations there, which suffered from river blindness and trypanosomiasis and, of course, filariasis and trachoma and scabies and all the neglected diseases. So I learned a lot about work that was going on in Africa, Latin America, and how actually you need global efforts to deal with these huge problems, public health problems, because you need innovation, you need, of course, the pharma companies to develop those drugs and make them affordable and available. You need scientists and researchers from around the world that are pooling their intellectual capacity to attack a particular problem, whether it's a new diagnostic or a new drug combination. And you need governments who have then make the commitments to actually control those diseases within their own borders. So the WHO gives you that platform where you are actually in a position to convene all the world's leaders, whether they are health ministers or whether they are scientists. And again, during COVID, we saw the same thing. As chief scientist during that period, my biggest satisfaction was that we could coordinate and support and the scientists who were working on different aspects of COVID and use that knowledge as it was coming out on a daily basis to update our guidelines and recommendations for countries. So no country alone, can address issues like pandemics or climate change or even tuberculosis or HIV/AIDS. This is why we need multilateral organizations where we all have a seat at the table and we can discuss and debate. Particularly important for low and middle income countries that we have this kind of platform, because the market is not going to solve our problems. It's only this collective action. And the fact that you and I can sit there and actually talk about these issues, these problems, which probably a lot of people in the global north would not encounter the situations that you or I have encountered, in India or Pakistan. It's very important to have our voice heard.
Absolutely. I think it is, you're absolutely right. It is so important to have that place on the table because like in pediatrics, it is the same. And I'm sure you found the same differences in research in OB/GYN practice as well. The problems or the common problems that women come to the hospital in UK are almost 80% different from how we see problems. Yes. Here we can see obstructed labor, we can see this, and you would never, ever see that in the UK when I was doing my training. But then urogynecology, how to talk to the woman, how to give her time, how to give her that private space, because in our clinics here in the government hospitals, we have like 300 women in the outpatient. To talk about privacy and confidentiality, it's just not feasible. But you learn a lot, but then you have to blend the knowledge that you got there with your requirements locally. But one thing it really comes strongly to me that the value of woman as a human being is something my training overseas really, really brought home. Because like here, they could be waiting, there would be 20 of them, 15 of them, but then you learn that, they also need their quiet space. They also need that bit of, pampering and that individual attention. And particularly the divide between the gender inequity, that's a huge factor in our societies as well. So I'm sure you would share that feeling with me that if we were not so empowered by our families, our parents, especially, I think our fathers.
Yes.
The journey would have been different, I suppose. So that's what I keep hammering into women that I meet, families, women, men, that, treat your daughters and your sons equally because they have the same culture.
Bilkul, absolutely. Bilkul said. But also, I think not everyone has the good fortune of coming from a family that has allowed us to do what we wanted to do. And therefore, we also have to think about how do we support young women and also young men who are coming from backgrounds that are not so supportive and they haven't had the exposure, the opportunities that you and I have had. And this is why I'm very passionate about, this developing leadership and helping young women who are starting off on careers in public health or in clinical medicine or in research to have an ambition, to not think that there is a artificial limit that's been set by anybody. If your male counterpart can do it, you can also do it. There is nothing in this world, I believe, not a single thing that only men can do and women can't do. Absolutely. That needs to be reinforced because many girls are told, no, you can't do this. Don't aim for all this. it'll be too much for you. Who'll take care of your children? Who'll take care of your family? You know, how can you go to another city and work there? How can you leave your husband? So, because I've done all these things and I know that people have talked about it and said, oh, she's left her husband to look after the children and she's gone, you know?
I heard that about my parents.
Okay.
Look at them, poor, they in their age, they're going to have to look after the children. But anyway,
Right.
they joined me in 6 months' time. But you heard that.
Yes.
Yeah.
So the guilt feeling, they try to build a guilt feeling in you, society.
Yeah.
So how to fight against that?
मुझे ये भी लगता है कि it is important that in gynecology at least the men are like excluded most of the times. So people think of them as a problem, but I always think that men are, I don't know whether they are the entire problem or not. It's the women who kind of hold back women, but men are definitely a part of the solution because he may be your father, he may be, and he may be your son, he may be your brother.
Yeah.
And if they know, it's like एक तरफ आप व्हील लगा दें, टैंक का, और दूसरी तरफ आप टायर का लगा दें. So the husband is all empowered and educated, and the wife is like all timid, quiet, no education, no empowerment. So the family won't run.
Correct.
I think that is a very important component of girls tend to let they do.
So I think the way we bring up boys and girls, the social norms, and the gender stereotypes, that's still very much prevalent. The gender stereotypes that girls can go for certain professions, boys should go for others. So I think having role models is very important. And interestingly, when I became the chief scientist at WHO, a lot of young women from all over the world wrote to me saying that, seeing you as a chief scientist of WHO tells us that there is no glass ceiling, essentially.
Yes.
That a young woman can aspire to be, the head of WHO or have a very senior position in WHO. So I think having those role models, and I'm trying to think, did I have role models when I was young? And I had very strong role model within family because both my mother and grandmother, were very strong women. They were feminists. And I'm sure it was the same with you. But, and we had professional role models as well. So did you have some when you were training?
Yes, definitely. It was really funny, like you said, you left your husband. My father, we came from a very traditional kind of Rajput family, and my mother was, she had done her master's, she had done her bachelor's when they got married. And when they got married, my father wanted her to study because she wanted to study. So she did her master's. Then she did other masters. Then I was in class 6 when she went to do her PhD because my father said, go and study. I'll be good enough to look after her. Amazing. So when I went and my children were with my father, the village, the people who were related to me said, look at him, poor him. Pehle he was looking after बीवी चली गई, बच्चे छोड़ के, बच्ची भी चली गई, सबको छोड़ के.
Now the grandchildren.
Now the grandchildren. But actually, I think that is what defines your generations to come.
Yes.
And it is ever so important to have that strong confidence behind you. Even if I've done something wrong, I knew that I will not get a stick from my father. No way. And I think that confidence, allows you to build upon because we all make mistakes when we are learning. So I think that is very empowering. And then also, I think when you have that background and you start working and you work hard enough, then I think you always find people who inspire you. I had a couple of professors in the UK whom I still am in contact with, and a few who were then becoming consultants or now established consultants. It is very important because when you see their achievements, like when I was reading your profile, it made me so happy because, I think it's contagious when you have a positive attitude and when you want to help people and when you know that your struggle will finally lead to something. I think it is important. And my father always used to say that the people who win a Nobel Prize also have 24 hours and those who do nothing also have 24 hours. So you have plenty of time. It's your choice how you use it. So I think that is what our generations need, that they have to keep going.
Yes, yes. Your father is obviously a very wise as well as a very the feminist. Like my father was also a feminist.
Yes.
Otherwise, they wouldn't have brought up, I think, daughters like us. So,
Absolutely.
do you want to say a little bit about how your field has changed, since you've been in the profession? What are the innovations and maybe what are the things you're most proud of and the gaps that you see that still need to be filled?
Right. I'll start with the gaps because I think the biggest thing is कि urbanization की वजह से और कुछ social media पे, everybody can post positive and classified and unclassified.
Yes.
So the younger generation, I think, I could be wrong, they are becoming a little more cozy and comfortable. And I think struggle जितनी हम करते थे medical profession में and as an OBGYN, the fresh graduates are probably used to doing that. And we have a huge drain in Pakistan.
Right.
Which I think you experience as well. So that is also a problem. And then the third thing is that in OB/GYN, especially in this specialty, people fancy, or the young ones fancy things like laparoscopic hysterectomy, robotic surgery, very fancy, flashy stuff. And when you talk about treating anemia and, reducing the maternal mortality, the same causes that I studied like ages ago. So, it takes a little bit of convincing for the new people to understand that. Likewise, I think exercise बहुत कम हो गई है, physical activity कम हो गई है. तो बच्चियों में जो 26, 27 years ago when I came back, and I think we did not used to see so many hormonal problems. US बहुत है, obesity है, mood issues बहुत हैं.
Right.
I think that comes from comparison, social media.
Social media. I think anxiety and depression are going up amongst young people.
Yeah, absolutely. और जो upper class है उसमें इसलिए because मैंने आपकी पोस्ट देखी, आपने किसी और की देखी, तो ये नहीं है. और जो एवरेज हमारी या बिलो जो पॉवर्टी लाइन लोग रह रहे हैं उनमें ये प्रॉब्लम है. When we do camps, we always get that the mother's confidant is the eldest daughter. She shares all her worries with her. खाने को नहीं है, पकाने को नहीं है, अब्बा ने ये कह दिया, सास ने ये कह दिया. So those girls, we found out they were very, very depressed. They're malnourished, they are anemic, but they're like they're absorbing that trauma from their moms.
Yes.
That is something that worries me because कल को उसकी शादी हो जाएगी 14, 15, 18 साल पे, तो वो फिर एनीमिक ही, फिर उसके बच्चे, तो एक साइकिल, वो बिल्कुल सही बात है कि if you educate, or I would say feed a woman, you're feeding a woman. Unlike men, which is just that person.
So, I agree. I think adolescent pregnancies are still a major problem.
Yes.
Early girl marriage. And, we found some very disturbing data when we looked at the impacts of climate change on the health of women and children.
Yes.
We found that where women live in places, we looked only at India, now we're expanding it to South Asia, in places that have faced recurrent droughts or recurrent floods, that, climatic hazards which have really impacted their livelihoods, then it's the women and the girls who get impacted. Domestic violence, we found, went up significantly.
Absolutely.
We found a lot of course, reproductive health problems and more of anemia. Girls were getting married off earlier because I think families in distress, they tend to marry off their girls earlier. And even hysterectomy, the rates of hysterectomy were higher in those places exposed to high heat. So these kind of relationships with climate change also coming out now, with additional burden on women and young girls because they have to manage with less resources.
Sorry, go on.
No, Pakistan also had terrible floods a couple of years ago.
Yes, and
so many families were displaced.
Yeah. And climate change, really, I think that is the next big COVID, which is just really there because just the other day we were talking that it's not just ke health suffer karti hai. Your dignity, you're out of the house, you living in a tent next to meet strangers. most of the people who live in villages will not want their pregnant women, over 7 months, so which is visible, to come and visit. And in these floods, this has happened that they would kind of put their women away, put some boxes or charpais in front of them so that the medical teams can't see them, the rescue boats can't see them because they're afraid that they will take them away to the hospital.
Yeah.
Imagine. And gender-based violence, like you said, girls get attacked or molested on their way to the bathroom because there is no light. Unplanned pregnancies go up, unsafe abortions go up, and it is becoming a norm. If it's not flood, it's an earthquake. If it's not earthquake,
absolutely no. I think this is a big challenge for our health systems, and perhaps they haven't recognized the magnitude of the problem and how they need to adapt to this. So, as you said, in a post-disaster situation, the needs of women and girls is very different. In addition to all the other needs of food and you need safe space to be. You need your menstrual health, your reproductive health, your toilets, and the risk of always undergoing some kind of gender-based violence is much higher when you're all cramped up like that So these new challenges, which we are going to face more and more in the future, it's a reality, and we will need to prepare our health workforce to deal with this.
And also, apart from the health workforce, Dr. Soumya, it is also important that, it's the same kid from where your money is coming, from the government, for the provinces, and for the people as well. So if you've lost everything in the floods, or the government is channelizing their resources into flood and everything, the usual routine work also suffers. So it's not just that temporary duration, it's also during the rehab, and then people have lost their property and homes or livelihood or the animals in the village. So it is becoming a constant threat. And anemia, anyway, it's rampant. I think it is probably the same in both continents, both parts. That our girls are never. You hardly find somebody in the village or in the camps who has a hemoglobin of 12. 6 or 7 is an average. Because 10 people tend to feed their sons a little better than they feed their daughters. Although I keep telling them, your son is not having the periods, your daughter is having the periods. She is actually losing blood. She's the one who's going to get pregnant. She's the one who's going to deliver, and she's the one who's going to breastfeed. But I think we just have to keep doing it,
keep repeating it till the message gets home. Now, let's perhaps, as we close up our conversation, think of the future, what we hope to see happening, and what personal impact are you most proud of, or do you want to leave behind? What would you be proud of when you look back at your career?
Right. I think one thing that I thank Allah for repeatedly is that my patients and the people whom I train, they tend, or the relatives of the patients that I have, they relate very well to the fact that I was very kind, I was very patient, I described everything to them, I explained everything to them. They felt very valuable and respected. And similarly for the trainees and the students that we have in the trainings, I think the humanizing gynecology, not teaching them the science, but also humanizing it. I think that
very
is
important.
I think that counts for me.
I think when I look back, a couple of things come to mind. One is nurturing and building a younger generation of researchers who, as you said, are not only passionate about the research and the finding out those questions you want to answer and undertaking a study well, but also are compassionate human beings. You treat your subjects, who participate in your clinical trials, not just as numbers, but as people. They have their own needs. You must get to know them and their families as well. And the ethics are very, very important when you do research, particularly when you deal with illiterate populations or people who are not so well educated. Then it becomes our responsibility that you undertake research ethically and you don't put them at any kind of risk. And the other thing I would say, looking back, is perhaps, from my later stints as the Director General of the Indian Council of Medical Research and later on as Chief Scientist of the WHO, is trying to put a spotlight on the importance of science and research. And I have advocated for it. I have spoken up for it constantly. The fact that governments must support science, that no country can become a developed country or, achieve economic prowess without investing in science, which means investing in education and health as well, so that your population grows up with good cognitive and physical growth. Because if you have a stunted population, malnourished population, you're not going to, achieve a lot economically. So investing in human capital is very important.
Yes.
Setting up institutions and supporting scientific and research institutions and financing them adequately. Supporting collaboration, especially I think in our part of the world, I can say in South Asia, we have very common issues and problems. We should engage, because I feel that health and research are things which can actually try and break some of these geopolitical constraints. And we could actually generate knowledge and benefit the populations regardless of, which country we happen to live in. And then I think working with people from around the world always enriches you. You always learn more, you get new ideas. You also see what others have done well in their countries, and you learn and you try to bring it back to your own context. So that international exposure is very important for our young people. It also helps to build confidence and skills, because the first time you go as a young person, you may not speak. You're completely overawed by all the experts sitting around the table. The second, third, fourth time you pick up your confidence, you speak, people start respecting you. So we must give our young people a chance to go to international conferences, meetings, seminars, WHO convenings, rather than the same people at the top always going, to the meetings. We should encourage our juniors actually to participate.
Absolutely. This is like you're actually echoing what we speak from heart. This is really, really true. And I think giving the newer generation a chance and encouraging them to take the next step, I think that's a huge investment into the future, because somebody is going to have to step up.
Exactly.
So that there is no vacuum left. And life is just like that. People change, but I think the system only develops when there is sustainability to it. And I think nurturing the younger generation is extremely important. And also I think probably all little things that we do matter. And I think they are very important for young people, because they might not be able to achieve a huge lot, but whatever little good they are doing, it is important to tell them that it will all add up.
Of course.
It keeps adding up.
You need to keep encouraging them. And, there are initiatives now like Women Lift Health that I'm a part of. I'm on their international board. And they actually pick up young women at mid-career from the health sector, could be private sector, government, allied health services, and take them through a 1-year period of mentorship and leadership building, so that at the end of it, they come out much more confident. And they also then develop a group of peers that they can turn to when they face challenges in their life. Because I often think if I had someone I could confide in, and talk to at the time when I was actually undergoing a lot of stress, someone of my peer, or maybe a little bit senior, it would have been great. So we should also encourage our governments to build flexibility into the rules. In government service, a woman who takes off for a few years, often then you find you've exceeded the age limit and you can't apply for the job. Or all your male colleagues have moved ahead in their work and you're struggling because you've taken off 4 or 5 years to raise children. So Indian government has made now some schemes to support especially women in science. You can take a break and come back, and take extended breaks. You can, have flexible working hours and things like that, which are very important. Also creche facilities, care facilities for people who can't afford to have, if you can't afford to hire someone full-time for your home, you must have a creche at the place where you work. where you know your child will be well looked after.
Right. These facilities are essential because women versus men at workplace, my experience is that women have to really work harder than men's to actually prove that they are just about as good as men.
Absolutely.
Absolutely. So, apart from that other burden, it is really important because, and I think women need to support women. I am a very strong believer of that.
Men and women need to support women, but certainly women need to support each other.
Absolutely.
I've had very good male mentors in my life. So I believe that men can also be great mentors and supporters and allies for women. So, as we close, maybe final thoughts or reflections on the way forward. I've really enjoyed speaking with you and sharing our life stories.
Same here. It's very interesting. There were so many things common. I mean, I read your profile pretty much from everywhere where I could have. But, yes, it has been a pleasure indeed. And I think the way forward is that we have to try and do something good, learn something new, and keep going every single day of the life that we have, because I think the life is way too precious. Time is way too precious. And I think it's probably the most priciest commodity that we have. So it is important to give back, and it is very important to nurture girls and women who can become a better human being, a better mother, better sister. They don't have to be, the top brass, but whosoever they are, they should become the best version of themselves.
Absolutely.
Any words?
And I think that, by conversations like this, by speaking about our own experiences and our professional life, we bring out the fact that it's not always rosy, it's not always easy. There are ups and downs, there are challenges in life, but that shouldn't mean that you give up. So young women, young girls, who want to pursue a career in medicine, or in fact in science, technology, or engineering, what we call STEM, must be encouraged and must be given every support possible to do that, with, as I said, some flexibilities being built in for the unique needs of women, because in addition to their professional career, they also have a biological life that very often they have to fulfill, and there's a limited window to do that. So we have to support that as well. But I think that I feel optimistic. I feel optimistic when I see the changes which have happened in the last couple of decades, and how many more women are now, going forward and, pursuing very serious careers in STEM. Now, I hope in the next 10 years or so, we'll see many more women in leadership positions, both at the national and the international level, because I think that will make also a huge difference to the whole ecosystem when you have a balanced, gender profile at the table. So thank you so much, Noreen. It was lovely talking to you.
It was, absolutely. And I hope that we can stay in touch. Thank you very much.
Let's do that, yeah. Thank you. Bye for now.
Bye.